Hi, my name is Dr. Rajadnan Ahmed and I am a psychiatrist working in UK, and I'm making this series of videos where I'm tackling some of the most commonly asked questions which you might encounter in a medical interview. This is particularly for the benefit of the IMGs who may not have seen or heard about these questions before. Remember, I'm not trying to give you any model answers. I am giving you the principles and the concepts behind these questions. Every job is different, everybody's CV is different, everybody's experience is different. So you can just listen to this and then have your own individual answer or develop some understanding of how to answer these questions. So let us tackle another commonly asked question, which is that tell us about your teaching experience, especially if this job has some teaching element or an academic element. This question may be asked, or even if this job doesn't have a teaching element, teaching could be part of any doctor's routine work. Medical students can come to our wards, and or junior doctors can we may be responsible to teach them as well. So you need to be you need to have some understanding of this question. When they ask about your teaching experience, how will you tackle that? So they may directly ask you, tell us about your teaching experience, or they may ask you what sort of teaching have you done, what do you enjoy about teaching, what teaching skills do you have. All of those questions are sort of on the similar line. So remember, when they are asking you about teaching experience, they are not just asking you about what you taught. They are asking you what skills have you developed through that. So I've seen a lot of IMGs, they tackle this question by telling, I've been teaching medical students, and then they'll stop there. Or somebody will say, I was a demonstrator in a medical school, and they think that's enough. But that's not usually enough. You need to, as I said, need you to sort of give them a little bit context of what you were teaching and what was the methods you were using. So for example, if you were teaching on the ward to medical students, was it a bedside teaching? Was it small group teaching? What sort of topics you were teaching? Was it something that you were demonstrating to them, or you were teaching them some practical skills? If you were a demonstrator in a medical school, then what sort of topics you were teaching. And as a teacher in a medical school, you have more responsibilities. Like, for example, you may be assessing the students as well. You may be setting up MCQs. You may be setting up the exams. You may be setting up other standards. You may be involved in the improvement of the curriculum. So all of those things you should be able to mention, because that will show you that the depth of your teaching experience and the methods you've been using to teach. Also remember, when they're asking you about teaching, they're interested in knowing that what skills you have developed as a teacher. So, you can go on Google and search for skills of a good teacher and sort of relate it to your example. But generally speaking, a good teacher is a good listener. The good teacher is a good communicator. A good teacher also have empathy. Good teacher understand the learning needs of the student. A good teacher can show some examples to lead as well in particular situations. So all of these examples, all of these skills can be related to you, and these skills are transferable from a teaching environment to a clinical environment, and this is something that you can use to your advantage. Again, if you are doing a teaching, that one of the advantage, one of the question they might ask you is that what are the things you enjoy about teaching, and what do you think is beneficial to you as a teacher. So if you are trying to teach a topic, like for example, if I'm trying to teach depression, I must have better understanding of depression myself. So I must first learn about depression and then teach it. So anybody who's involved in teaching or doing teaching, they also keep their knowledge up to date. And that is an advantage for them to actually also in the clinical environment, their knowledge is much more up to date. When you're talking about your teaching experience, you can also include some leadership skills. For example, I give you an example that you may say to them that I was on so and so ward, and I saw the medical students were coming to the ward, but they were only observing random things, or they were not actively involved with anything. So I actually approached the medical students. I directly contacted them and I asked them what are their learning needs, what are the things they like to learn, and they gave me some list of the required assessments they require. So I set up a teaching session for them. I give them a small talk on certain topics, and I took them to the patient and I observed them doing certain skills. For example, observed them taking history, and observed them doing physical examination, and I observed them taking bloods and all of that. So then I was able to give them feedback and also take some feedback from the students of how I was teaching them. So this particular example is also example of leadership. So you are not just passively observing the students or just being involved when they were on the ward, but you're actually taking initiative. You're approaching them, you're understanding their needs, you're actually taking them through and developing something new for them. I think that is what leadership is all about in that particular context. So remember, teaching has several examples, and it's not just about teaching the students, it's about developing those skills, and those skills could be applied to your clinical background as well. So for example, if you have developed good communication skills via teaching, you have good ability to explain things that could be used to explain simple illnesses to the patient as well. Then whenever we are working in as a doctor on a ward, we may have students coming there, student nurses coming there. Sometimes we have to explain those things or teach those things to our colleagues working with us, which could be nurses or a junior doctor or a house officer that is working under you. So teaching skills is actually an essential part of any doctor's day-to-day job. So you must sort of understand that, and also develop some understanding around the skills that you can learn from being a teacher, and how can you improve those skills, and how can you use that skill in the clinical scenarios. So in summary, get an examples ready about your teaching ability and teaching skills. Link those skills to your personal development, and also talk confidently how these skills have helped you to improve as a doctor. I hope this video was useful, and I will tackle some other commonly asked questions in the next video. Thank you very much for listening to me.